When we refer to a surgery as something called an open fetal surgery, that means, unlike using a camera or a laparoscopy, which we term fetoscopy, we are talking about actually making an incision on the uterus itself. And in order to get to the uterus, there's first an incision made on the mom's belly. Once you have an incision made on the uterus as a way to get to the fetus and perform the operation, that incision, of course, needs to be closed, and it's sewn closed, and then it needs to heal properly. But whenever you have a scar tissue is never as strong as the native tissue that would have been there originally. And so the thing to think about is when you get pregnant again and the uterus grows and enlarges and distends, especially toward the end of the pregnancy, that tissue is going to thin out and be under some degree of stress and is not as strong as the tissue would have been had it just been without a scar. Therefore, it's really important to consider this. You will need to have cesarean sections for delivery in the future. Going through labor and that sort of stretched out uterus, then having to contract for hours and hours on end, is too high of a risk for it to actually rupture or separate. And so when you do have an open fetal surgery, one of the things you need to remember is the future deliveries will be by cesarean section. That's a little bit different than when you're having a regular obstetric cesarean section where you can actually have a vaginal delivery in the future. This is a different type of incision. It's too big, it's in a place that we wouldn't normally do a C-section on the uterus, and it is weaker. And the other thing to consider is in the future, that cesarean section will need to be a few weeks earlier than your expected delivery date. Again, because we don't want the uterus to get to that very last portion of the pregnancy where it's utterly stretched out to its max, and we'd like to avoid you going into labor if possible. So you'll be counseled that at the end of the pregnancy, perhaps a few weeks before your due date, delivery will start getting planned. The other important question that comes up is, does an open fetal surgery affect fertility in the future? And in fact, it's been well studied and it does not affect fertility. All of our patients over 20 plus years who have wanted to have babies after having had fetal surgery have been able to successfully get pregnant.